Have you or someone you love ever experienced shortness of breath just from walking across the room? Maybe there's this nagging fatigue that won't go away, no matter how much rest you get. Or a strange pressure in your chest, a flutter in your heartbeat, or swelling in your ankles that seems to creep up quietly. Here's the hard truth: these aren't just signs of getting older. They could be the first, silent signs of heart disease. And for seniors, they're often overlooked, written off as just age. But what if that shortness of breath is your heart struggling? What if that fatigue is your body begging for help? Heart disease is the #1 cause of death in people over 65. And the scary part? Many warning signs are missed, because they don't always show up as classic chest pain. In this video, we'll reveal the critical, often subtle warning signs of heart disease in seniors, how to identify them early, what's normal and what's not, and how to protect yourself or your loved ones. If you're over 60, or care for someone who is, this might be the most important video you watch this year. The aging heart, what changes over time? Let's begin by understanding what happens to the heart as we age. Your heart is a powerful, tireless muscle. It beats over 100,000 times a day. But just like every other part of the body, it changes with time. As we get older, the heart walls can thicken. Blood vessels may stiffen or narrow. Heart valves may leak or harden. Electrical signals that regulate your heartbeat can become less efficient. These changes don't always lead to disease, but they do increase risk. What's more, years of high blood pressure, high cholesterol, smoking, poor diet, and lack of activity can silently damage the arteries, laying the groundwork for coronary artery disease, heart failure, and arrhythmias. The good news? Heart disease is often preventable, and early signs can be recognized and treated. But you have to know what to look for. Fatigue, the most common warning sign. One of the first and most overlooked signs of heart trouble in seniors is persistent fatigue. Now let's be honest, we all slow down with age. But this isn't just tiredness. This kind of fatigue feels deep and persistent. Doesn't improve with rest or sleep. Can make everyday tasks, like folding laundry or walking the dog, feel like climbing a mountain. Here's what's really going on: if your heart can't pump enough oxygen-rich blood to your muscles and tissues, your body runs low on fuel. Your muscles get tired. You feel wiped out. All the time. If you or someone you love is experiencing unexplained exhaustion, especially if it's new, get it checked. It might not just be age, it might be the heart. Shortness of breath, a silent signal. Are you finding it harder to catch your breath? Does climbing stairs feel like a marathon? Do you wake up gasping for air? Do you need to sleep propped up on extra pillows? These may be signs of heart failure, where the heart can't pump efficiently, and fluid backs up into the lungs. This isn't just a lung issue. It's often the result of your heart not keeping up with your body's needs. This symptom is called dyspnea, and it's extremely common in seniors with heart disease. Yet it's often mistaken for aging or being out of shape. Breathlessness that's new or getting worse is not normal. It's your body sounding the alarm. Swelling in the feet, ankles, or legs. Another subtle but serious symptom of heart disease in seniors is swelling in the lower body, especially the feet, ankles, and legs. This condition is called peripheral edema. It happens when blood flow slows and fluid starts leaking into nearby tissues. Your shoes might feel tighter. Your socks may leave deep marks. Your legs may look shiny or feel heavy. Swelling can also be caused by kidney or liver problems, but if it appears alongside other symptoms like fatigue or breathlessness, it points to the heart. Right-sided heart failure is often the culprit. If swelling is consistent and not explained by medications or diet, it's time to talk to your doctor. Chest discomfort, more than just pain. When people think of heart disease, they think chest pain. But in seniors, it often shows up differently. You may feel pressure, heaviness, burning, tightness, discomfort that comes and goes. It may radiate to your shoulders, jaw, back, or arms. Or it may feel like heartburn. In some cases, it's so mild that it gets dismissed as indigestion. But this could be angina, a sign that your heart muscle isn't getting enough oxygen. If chest discomfort happens with activity and eases with rest, it's a warning sign. And if it's sudden, severe, or comes with shortness of breath, sweating, or nausea, don't wait. Call emergency services immediately. It could be a heart attack. Irregular heartbeat, the hidden danger. Have you ever felt your heart flutter? Skip a beat? Or race for no reason? That could be arrhythmia, an irregular heartbeat. One of the most common types in seniors is atrial fibrillation. This isn't just annoying. AFib can increase your risk of stroke, blood clots, and heart failure. Signs to watch for: fluttering in your chest, skipped beats, lightheadedness, fainting, dizziness. Sometimes these episodes are brief. Sometimes they last hours. Don't ignore them. Even occasional fluttering could be a sign that something's wrong with your heart's electrical system. Confusion or memory changes, the heart-brain connection. Here's something most people don't realize: your heart and brain are deeply connected. When the heart can't pump enough blood, your brain gets less oxygen. This can cause sudden confusion, trouble concentrating, short-term memory loss, a foggy feeling. In seniors, these signs are often misdiagnosed as dementia or Alzheimer's, when the true cause may be heart-related. If mental changes come on suddenly or alongside physical symptoms, it could be a sign of reduced circulation to the brain. The brain needs constant nourishment, and that comes from the heart. Cold sweats, nausea, or dizziness, atypical signs in seniors. Heart attacks in seniors don't always look like they do in movies. Instead of gripping chest pain, you might feel cold sweats, nausea or vomiting, sudden dizziness, a vague feeling of doom, pain in the upper abdomen or back. Women are especially likely to experience these atypical symptoms. If these signs come out of nowhere, especially after exertion or stress, get help immediately. They may be signs of a silent heart attack. When to seek help, and what to do next. So, when should you call your doctor? Right away, if you notice new or worsening fatigue, unexplained shortness of breath, swelling in the legs, chest discomfort, heart palpitations, dizziness or fainting, sudden confusion. If it feels urgent, don't wait. Call emergency services. The sooner you get help, the better the outcome. And prevention? It's powerful. Here's how to reduce your risk: eat more fruits, veggies, and lean proteins. Move your body daily, even gentle walking. Manage stress. Get regular checkups. Control blood pressure, cholesterol, and blood sugar. Quit smoking. Limit alcohol and processed foods. Even small changes can make a big difference. Final thoughts: listen to your heart. Your heart has been with you through everything. Every joy. Every sorrow. Every step of your journey. It beats for you, silently, every second. But when something's wrong, it whispers. It nudges. It pleads for your attention. The warning signs of heart disease are not always loud. But they are always important. Listen to your body. Respect its signals. And act, before it's too late. If this video helped you understand more about your heart, please give it a thumbs up, subscribe to the channel, and share it with someone you care about. You never know, this information might just save a life. Take care of your heart. Because it's been taking care of you, every single day.